My guest today is Dr. Sanjay Agarwala, one of India's most respected orthopedic surgeons, who is known for his work in joint replacement, AVN, and in complex trauma care. His stated purpose is not just helping his patients walk again, but helping them regain their mobility completely. He's pioneered work in AVN that has helped patients across the country, and he speaks to us today about caring for our joints and our bones better. This conversation is part of a collaborative series that our team at Beetroot is doing with the folks at PD Hinduja Hospital and Medical Research Center. Take a look. Dr. Agarwal, thank you so much for speaking with me this evening. I think I'd like to divide this conversation into what we can do to protect the joints that God gave us,
Right.
and then what we can do to replace the joints once they need that surgery and what that surgery is like and the recovery time. And, we can talk about all of the different kinds of surgeries that you specialize in. But I want to start off by asking you, in general, among the patients you see, what are the most common complaints that Indians tend to have about their joints, about their bones?
Well, thank you, Faye. Thank you for having me on the show. Patients come to me when they have a problem. I mean, they come with dukh and dard.
Mm.
They don't come to me if they're feeling fine. And the aches and pains are normal things that happen to people in their lives. And what we want to do for them is get them better, not necessarily with surgery, get them better with medicines, with lifestyles, with exercises, physiotherapy, wraps, splints, braces, and get them back to their normal life.
Mm.
Life is motion, motion is life. And we want all patients who reach us to get better. So that's what every single doctor wants to do. Any patient reaching them should get better. And that's what I do. When patients come to me with aches and pains, I analyze what's wrong with them. I do investigations as required to pinpoint and hone in on a diagnosis,
Right.
and based on which then I can offer them a line of treatment which hopefully makes them much better than they were.
What is the difference between osteoporosis and arthritis?
So osteoporosis, the very word, is bone with holes.
Okay.
Osteoporosis is softening of the bones. And osteoarthritis is bones which are now arthritic. Arthritic meaning painful and therefore degenerated. So those are two separate conditions. I treat both of them depending on what patient comes with. But osteoporosis and osteoarthritis are in the realms of bones. And therefore, I am a bone doctor. So I treat bones.
What causes arthritis and osteoporosis?
So there's no one cause for anything.
Okay.
Osteoporosis is an aging process. It can also get precipitated by less calcium, less vitamin D, less nutrients like proteins. And with the aging process, obviously, this all gets accentuated. On the other hand, if you have a very active person who's doing exercises, taking supplements, in spite of whatever his gene makeup is, he may not be suffering from osteoporosis. And that's the realms of living longer that we are looking at nowadays. That's the same thing that happens even in blue zones. People live longer because they live better. And the same thing applies to our arthritis.
Every time I travel overseas, at least, I was in Singapore recently, and you see people of a far more advanced stage being very active, cycling, running, walking, taking the bus, taking the train, using public transport a lot more, though we see the seniors in India uh, being active. Is it the way we've designed our cities, or is there a reason why urban Indians are not as active as we see in other cities, other big cities of the world?
So it's not genetic alone,
Okay.
it is lifestyle. And in fact, Singapore has been declared as a blue zone recently. It's another area where people can live longer. And everyone is working towards living better and longer. Singapore itself, since you mentioned it, was a tiny island. 60, 80 years ago, before Lee Van Yu came there,
Yes.
it was a desolate place. They changed the environment. He brought in greenery. He brought in advanced road sense. And every single thing that was done in such a place was to improve lifestyle. Unfortunately, in India, what we see is that people are fighting for an existence. There, people are living their lives. And when you live your life in the correct manner, with the right education, with the right backup of the government, with the right environment, you live longer, you live better. So, exactly what you've seen
Yeah.
is what we should be aspiring for.
Would you be able to tell us what kind of exercise we need to do if we want to maintain our joints for as long as possible, naturally?
So, the joints, there are about 300 odd joints in the body, 512 odd bones in the body. And the joints which function, which allow movement, they have cartilage, which gives you the cushion. It has synovial fluid, which is formed as a lubricant. And then you have the muscles which act across the joint to get motion.
Mm.
You need muscles for the motion. You need intact cartilage for the smoothness. And you need the lubricant, which is the joint fluid. All of these happen if you're doing physiological things. But over a period of time, if your cartilage breaks down, or in fact the bone starts getting osteoporotic, you would then get arthritis earlier. If you have a disease like rheumatoid arthritis, or
Yes.
you have a disease like gout, then your cartilage and your tissues get affected by your own body. And then there is a deterioration. But all is not lost. Because if you can identify the arthritis in time, you don't need to necessarily prevent it, but you can start treating it. If you identify that treatments are not working, is that the end of the story? It's not the end of the story. You have physiotherapy, you have splints and braces. I mean, I have weak eyesight, so I have glasses. So if you have a weak joint, you can have a brace. Works.
Mm.
But at the same time, there would be a time in life when that is not enough. And that's when you opt for surgery with a good surgeon. And that surgery doesn't necessarily mean joint replacement. You can change the angles of the bones so that you have better net results. You can do a synovectomy, take away the inflamed tissues which are causing this kind of arthritis. And all of this works towards making the patient wholesome again. That's my job.
Does lifting weights help the bones or damage bones?
So again, this is depends on what kind of weights you're lifting.
Okay.
If you lift too much suddenly, you'll crack a bone in the spine, or you get a slip disc. But if you gradually work on this, and till the age of 18 to 25, if you're lifting bones, your bones become stronger, and that strongness remains for life.
Okay.
So if you do weight training exercises earlier in life, then you ward off some amount of osteoporosis.
And if you take it up later in life, because now we see a lot of people interested in longevity and interested in quality of movement. And so we have 40-year-olds, 50-year-olds, women in the gym at 60 and 70,
Sure.
working on their mobility.
So that helps. But if you overdo it, you can break a bone, you can grind down your joint, you get osteoporosis and you get osteoarthritis.
Is walking 10,000 steps a day a good target, or does it wear down your joints?
So that's a good number because that's been physiologically shown to work. But 10,000 is just a number. Suppose you were to do 12,000, are you overdoing it? No. If you were doing 8,000 or 7,000, is that a good number? Probably yes. Out of the 8,000 or so, if you were doing at least 20%, that is 200 or so, brisk, then that helps your cardiovascular system, it helps your muscles. So if you were doing you were lolling around and doing your 8,000 steps, probably wouldn't work. But if you were to do a certain number of steps a day, and then you can quantify it weekly and divide it. But in case you were doing less steps, if you were doing activity like they do in the blue zones, it would work as well.
And so by activity, you mean, do the gardening, do the mopping, the cleaning, bend down and pick up your child.
Absolutely correct. You hit it spot on. That is the kind of activity, if you're doing continuously, that is part of the activity that keeps your fluids in the joints, keeps your muscles working, and you do very well.
You did say a deficiency of calcium or vitamin D can lead to degeneration of our bones faster. Do you recommend taking supplements?
Absolutely.
Everyone
you-
all the time?
I think so. If you wanted to drink milk and get enough calcium for the day, you'd be drinking a liter of milk a day. That's just not possible.
Yes.
So I think you need to have supplements, and that's a very good thing to do. And if you have your normal diet and supplements, is even better. Now, calcium, if you don't have vitamin D, will not get absorbed.
Yes.
Calcium, if you eat and you have a gut problem, it will not get absorbed. So there are a lot of nuances to this. So the best thing to do is to take appropriate supplements on a regular basis, including vitamins.
Hmm.
Not only vitamin D, but even the other vitamins.
Doc, what is AVN?
AVN is avascular necrosis.
Okay.
And avascular necrosis is something that I've worked with for 25 years, is a process by which blood supply to the bone gets blocked. If you get blood supply to the heart getting blocked, you get a heart attack, you have acute pain, and you reach a doctor very quickly. Otherwise, you're dead.
Yes.
If you get blood supply blocked off to your brain, you get a stroke, and then you need to reach a doctor quickly. Otherwise, you are paralyzed. But unfortunately, in the bone, all you perceive is pain. And that pain, you would shrug it off as a sprain, as something you did awkwardly, which is understandable. But if you have persistent pain, time to get to a doctor, get an X-ray and get an MRI if the doctor feels that that is required. Because if you have AVN, particularly in the hips and elsewhere in the body, I have described it in papers, and you can Google it or you can reach. I mean, that information is not private. We can reverse the disease for the first time ever with medicines. Medicines which are not expensive, medicines which cost, in our context, 1,000 rupees a month, which is affordable to most people in India. That is $12 a month. You can reverse the disease if picked up early. No surgery required.
So, if I've understood this correctly, AVN is when blood supply gets cut off to the bone. It often happens to the hip, and it leads to sort of the death of that bone because it's not being fed with blood. And it's only recently, and through the work that you are doing, that you found ways to treat this with medication as opposed to what was only surgery as an option after life.
Absolutely correct.
Yeah.
So when you get avascularity of any part of the body, clearly that would die.
Yes.
If you had no blood supply to a leg, it will get
That's-
gangrenous and you need to cut it off.
Yes.
If you get, like I said earlier on, if you get avascularity of your heart, you get a heart attack and it needs to be treated. If you get there fast enough, they can put a stent in, they can give you blood thinners and you can reverse it if you're very quickly with a doctor. Same thing applies to the brain. But in the bone, the pain is never that severe in the beginning. And you think that you may have had a sprain or an injury, or you awkwardly got out from the car, or you twisted your leg. Now, when that happens and blood supply to a part is, we are talking of hours. You don't have much time. You have a few hours. That is never reversible. But what happens in avascular necrosis when the blood supply is being blocked? The bone, which should be hard like wood, becomes soft like a boiled potato and starts crushing. And you start getting more and more pain. And later on, when the shape of the hip or the knee gets changed because of the crushing of the bone, you get severe arthritis and pain. And if it is crushed and it is effectively now destroyed, then you need hip and knee surgery. So this has been known, and in the past, when avascular necrosis was recognized, attempts were made by doctors, very qualified, very good and correct thing to do in those days, drill the bone to get more blood supply drill the bone and put cells in, which would probably grow. But my research has shown that this does not work as well as the medicines that I'm in a position to give 1,000 rupees a month.
And what do these medicines do?
This is a group of drugs called bisphosphonates, which have otherwise been used for 50 years for osteoporosis. But in the dosage and the formation that I give, in the formulation that I give, it allows for this soft bone to start becoming hard. It starts becoming hard, the pain disappears within 6 weeks. The patient knows it's working. We adjust the dose based on how good it is. And then over a period of 3 years, the bone has been preserved and the patient doesn't need surgery. Now, a small cohort of patients do not respond, either because their body doesn't respond, the disease is extensive, or they've come to me very late. All is not lost. I can operate them and give them full range of movement. And if you look up any of these sites of Mayo Clinic, Harvard, Stanford, they all say that after hip and knee replacements, you have restrictions of movement. You cannot sit on the floor, which Indians do. You cannot use an Indian toilet, which a lot of Indians do. You cannot play sports, which some people do want to do.
Yes.
The difference in the kind of surgery that I can offer them, because of the techniques which I've described and published, those techniques permit patients to get back to normal activity, normal functional results after surgery.
How is this technique different from what is otherwise performed?
So the ABC is the same. It's how you write your ABC, what curse you use, cursive or not. So that's what's different. And this is published data. If you look at my name and my publications, and it's not a secret. I've shared it in meetings. I've shared it with colleagues. It's doable.
Specifically for AVN and for any other ortho-led pain, a lot of times people tend to push through the pain or use a painkiller and move through the pain. Is that something you agree with, or do you think that
Not,
we should
not as an orthopedic doctor.
Okay,
No pain, no gain is rubbish.
it's rubbish.
If you're getting pain, you need to have this addressed and you need to go to your doctor. And why not? And I'm sure with the right line of treatment, you should be now pain-free at the end. That's what we try to do. We're not gods. We can't reverse everything. But I think there's a good chance that you get to the right doctors, they should be able to help you.
How should a patient know when they need knee replacement or hip replacement surgery or joint replacement surgery?
So you don't suddenly need a hip replacement or knee replacement. It doesn't happen suddenly.
Yes.
It happens over a period of time. You've gone to a doctor, or you've gone to your Ayurvedic doctor, or you've gone to your homeopath with pain. He's tried to treat you. Correctly so. Why not? And if your pain goes away, then maybe you're good. If pain doesn't go away and if it's persistent, then you need to ask your doctor what else can be done. And in the end, if your functional range is less, if your pain is so severe, and that your normal day-to-day activities are not happening, then it's a good place for you to consider surgery with the right doctor. The right doctor, right hospital, right instrumentation, all that has to be taken into account.
As a patient, how does one choose the right doctor, right hospital, right instrumentation? What should be on our list of evaluation?
Very difficult question. There are fine doctors which have come out of medical colleges, they're raw. Do they have the experience? No. So you need an experienced doctor. Based on the fact that he's experienced, does he have access to a hospital which has the instrumentation and requirement? See, gone are the days where you could just put a plaster on patients. Now we're talking of full functional recovery. And everything falls into place. A good doctor, well-trained, experience means time, instruments, robotics, things that I have access to and a lot of people have access to. Can I give the same kind of service if I was to be in a village? I cannot. I just cannot, because I can treat patients, I can put them in plasters and things. I cannot get the same degree of results without the equipment. the technology, the finesse, the experience, and the results. So I have a chap who is young like you. He had AVN of both hips. I treated him, but he had restrictions of playing squash. You can understand that. Squash and so on. A very strenuous game. His name is Vijit Raj. He was, before AVN, a seeded player Indian squash teams, Madhya Pradesh. He was number one in squash. So I said, beta, AVN hai, hamara dawai lo. He took it and all that. He said, doc, not working out for me. I want to play squash. That's my life. Understandable. So, okay, this is Vijit Raj.
Hello everyone, I am Vijitraj Rishi. I was a patient for vascular necrosis. In 2013 I was diagnosed. 2015 Dr. Sanjay Agarwala sir did my right hip replacement, and in 2021 got my left hip replaced. And after that I've got back to squash, and today I've come to Bombay to play the nationals. I've played the states before this, played Central India before this, and my legs are working perfectly fine.
विजय चल के दिखाओ.
Sir.
ऐसा करो, वहाँ स्टूल पर बैठो आप. वंडरफुल. आइए ऊपर बैठिए. आलती पालती मार के दिखा दीजिए. और दोनों हिप्स के किए हैं. ऐसा है, लोगों को लगेगा कि आपका ऑपरेशन ही नहीं किया. जख्म दिखाओगे जिस साइड में लेट के.
जिस
That's the scar on this side. Show me the other scar similarly. Okay, so that we have operated. The guy is a national sports player, squash player. Seeded, he's coming to Bombay too. So I called him home for dinner. See here? So does this happen? I mean, this is what we're looking at. This is modern technology. This is what I offer.
Doc, let's talk about the surgeries, the hip replacements and the knee replacements. They've become a lot more commonplace among urban Indians. And what should one expect when going in for one of these surgeries? You said people tend to recover their mobility fully when you do the surgery. So when a patient comes to you, what can they expect, or what should they expect out of this surgery?
So you reach for the stars, you hit the rooftops.
Yes.
When I trained in England and in India, we would tell patients that they will have restriction of movements. Now, over this period of time, what I have done, I worked at each refinement that I could think of that would give better range of movement and quicker return to normal life. And I published papers on this. I have close to 100 papers now. So it's in the realm, of how I do it, why I do it, what are the nuances of the special things I do. So if you have a knee replacement or a hip replacement with me, Hinduja Hospital, the place where I worked for 40 years, patients should expect that if I operate them in the morning, they're standing and possibly walking by the evening. Patients should expect that by the time they're discharged, 3 to 5 days. And why is it 3 to 5 days? Well, 1 day before surgery, 1 day off the operation, 1 day after, I mean, that makes sense, 3 days. Everyone is not that fit that they can really walk out of the hospital 3 days, maybe a day or two extra. So generally, I say 3 to 5 days. Some patients may be very good on the second day. I could say, okay, you may go home. Some patients may need a little longer, but I think 3 to 5 days is the time period during which they should be able to get to the commode. They should be able to sit, because if you can't sit, how will you go home? Yes. I mean, you will need an ambulance to go home. You need to be sitting in a car. They should be able to take steps. Anywhere you go, might need a step to get into the bathroom or the toilet. They should be able to do all this before they leave us. So that's what I hope for. Many years ago when I was in training and we would do these kind of operative procedures, we'd keep them in for 2 weeks at a time for a fortnight. We'd give them exercises. We would do all that, quite rightly so. But I think we have modern medicine. We have modern techniques. we have physiotherapy, and we have a host of things that should make patients do better, quicker, faster. And I think what we really need to and let people know is that they go to the right doctor, the right place, they should get the same kind of results. Sure, I say I'm better, but that's me.
How should patients care for their joints after replacement?
So you do need a certain amount of physiotherapy or exercise. If you get a physiotherapist to help you, it's physiotherapy. If you do your own exercises, you're helping yourself. So you've had a cut across a joint, and clearly your muscles have to know that they need to now regrow, re-perform so that they can support your joint. So you need a certain amount of exercise. And during this period of time, if you have pain, we do have a very large armamentarium of painkillers which are given to patients.
I do want to ask you about perimenopausal and menopausal women. It's a specific stage of life when bones and calcium drops, bone density drops, muscle density drops, um, and they tend to have fractures. They tend to hurt themselves more. What care should be taken during this stage in order to look after bones and muscles? And is there anything that can be done to support if to support these bones if the degeneration has already begun?
So I think the first step is in recognizing that this does occur.
Yes.
So a large number of people think that they were living normal lives, eating normal food, nothing can happen to them. That's not true. Because what happens perimenopausally is that the protective hormones in the woman's body drop. Unlike men, where you don't get so much of a drop when they get older, perimenopausal women, estrogens drop. Estrogen being low, it starts working towards decreasing your bone strength, starts working towards getting you wrinkles,
Yes.
it starts working towards making you look old. But that's not really something that you should avoid. You need to tackle it. So I'm not saying that you need to be perimenopausally on estrogen, but the supplements that are required and the degree of activity that is required can certainly make such a person wholesome again. And these are the realms of modern medicine. These have to be used to get good results.
If you were to give me 3 or 4 points that women of this age group, menopausal, perimenopausal women, need to be doing to look after their joints better, what would those be?
Certain amount of activity.
Hmm.
If you're a couch potato, it doesn't work.
Right.
So you need to do certain amount of activity. If you can't do that kind of activity, take out 15 minutes to 25 minutes of time so that you do some exercises. And a little bit of activity should suffice so that the person is doing well. You need supplements. I'm very keen on patients taking supplements.
Okay.
I'm very keen. Vitamin D, calcium, I said earlier, I mean, if you wanted to take it from food, you'd be drinking a liter of milk a day. It's not something which is practical. Hence, you need to take the appropriate supplements. And these two are not the only supplements your body needs. You need multivitamins. And it's harmless for you to be taking multivitamins. And it's old people's sort of granny's tale that if you eat well, live well, you'll get all your nutrients. You don't. I myself am a vegetarian. I cannot get B12 unless I take supplements because B12 is not there in vegetables alone. It's only in animal sources.
Yes.
So I don't have to become a non-vegetarian after so many years. But if I just take the appropriate supplements, which are not expensive in India, you just need to source it and take it.
Actually, I do want to ask you, there is this whole trend now about protein. Track the amount of protein that you're taking and eat more protein with all your meals. Indians tend to eat more carbs and less protein. As an orthopedician or and a surgeon, do you believe that that is hype?
No, it isn't.
It
It's
isn't?
true.
Okay.
Very true. So, an Indian diet, it's a great diet. I've lived on it for many, many years and survived, is more carbohydrate. It has to veer towards more protein. And you can get protein sources which are vegan, vegetarian, or non-vegetarian, but you do need more proteins in your diet. So you need to make a very conscious effort to get more protein. And everyone should be doing that, a gram per kilogram body weight, or at worst, 0.75 grams per kilogram body weight.
I do want to ask you this though, of the patients who come to you, what is the most annoying thing that your patients do that you wish they would stop?
So, very well-meaning relatives.
Mm.
Now, when you go abroad, and when I was abroad in training, I just get the patient coming to me and he'd have his questions. And very occasionally, you would have a spouse or a partner or a relative who might ask you relevant questions. In India, there'll be 10 interested relatives, and each one of them will have the same question. And once you've answered it and they're sitting there, they will ask the same question again. They're not listening to you. They're just trying to prove a point that I am so interested in the well-being of this particular person that I want to ask a question. That is annoying because you're repeating yourself. And in spite of the fact that you may have given an answer earlier, they've not heard it. That is sad, irritating.
Is there something we do on a daily basis that damages our bones and joints that we don't know of?
Yes. If you're not conscious of the kind of abuse you're giving the joint, it will deteriorate.
Mm.
If you are a heavy manual laborer and you're shoveling and you're lifting, you will wear down your spine. If you are someone who you're a footballer, over a period of time, your knee joint will give way faster than a twin brother who's not a footballer, because you are using your joint more. I mean, the word to use is abuse, but it sounds incorrect. But you're using your joint more. And nature, you have wear and tear and you have repair. Clearly, at a younger age, your repair rates are fantastically faster. If a young child who is say 18 months old falls and breaks a bone, it will heal within 3 weeks. And the same bone in a person who is older, an adult, will heal in 3 months. So the repair process is better in a younger person. It's slower in an older person, and that is physiological. It is not pathological.
How do we tell the difference between this is adequately active on a daily basis and this is abuse of my bones or grinding down my joints?
So, say we don't have a figure.
Yes.
There is no figure for it. But if your joints and your bones are telling you that it is hurting, what does that mean? Pain is your digital or your analog indicator that you need to look after me.
Yes.
So if I was to pinch someone, I said, okay, it's a light pinch, not hurting. If I was to pinch someone very hard, it would start hurting. The person will say, don't do it. Because the body is now getting pain. So now the person knows that this is to be avoided or to be controlled. So pain, if it happens in a joint or in a muscle or in a part of your body, pain is the indicator that things are not right, and therefore don't keep doing it.
How much of a factor does weight play on the damage we do to our joints and our bones?
Weight is an important factor. So let me give you an allegory which might sort of explain it. Suppose you have a car, and in the car, you have 2 people. You use the car going from Bombay to Pune. It works, not a problem. In the same car, you fit an elephant. You think the car will be able to get from Bombay to Pune? It may not even go 2 feet ahead because of the weight which is bearing down. And that is exactly what happens on your joints, which are weight bearing.
Yes.
Your knees, your hips, even your ankle and your foot. If you are overweight, you are grinding out your bones faster than the repair process can start. So there is a place to lose weight. And everyone thinks that walking, they can lose weight. That is wrong.
Okay.
The only way to lose weight really effectively is to cut down on your diet. And if you can't do a suitable diet, these great new drugs are phenomenal. These new drugs can help you cut down your appetite, can help you lose weight, and that is the way to go now.
I'm so glad you brought that up, because when we look at the GLP-1s, and one of the side effects of it is that you don't just lose the weight, you also lose muscle and you lose bone density. And there's now research from the UK and from other places that when the individual stops taking semaglutide, the weight comes back almost entirely fat. And so now you have, if you don't rectify a person with low bone density and poor muscle, mass as well, is that a risk specifically from your line of work?
Not at all.
Why
The
not?
very fact we now know
Hmm.
that if you are on one of these GLP-1 drugs,
Yes.
you can lose not only weight, but you can also lose muscle.
Hmm.
It's important to load yourself with proteins. It's important for you to be doing some kind of exercise. So once you are aware, you cannot take these drugs on a whim and fancy. It has to be supervised. So you need to go to an endocrinologist, you need to go to your physician who can make sure that these side effects are avoided. And yes, if you suddenly stop something, can it spring back? Yes, so therefore you shouldn't suddenly stop it. You need to get weaned off it. So your body is now aware that this is the way you will be, and you need the most important instrument that you need is a weighing scale at home.
Hmm.
Whether you take GLP-1 drugs or not, and you must weigh yourself. Once you keep weighing yourself, you're aware. That is awareness. The same way, you need to be aware if you're taking GLP-1 drugs that this is not all. You need vitamins, you need more proteins, and you need to be doing some amount of exercise so that you don't lose muscle.
Do you believe that now the GLP-1s are out of their patent in India and they're going to be available for as little as 1,000 rupees, a tenth of what the price was up till now, that it could actually change um, joint health
Yes, it will.
in India on a large mass scale?
Yes, it will, Faye. I have a large number of patients who come to me and they are obese. And I tell them that if they wish to have a very successful joint, be it replaced or not replaced, if they lose weight, it will work. And I keep hearing that since they are getting pain, they can't do walking. These are the very patients who need to cut down on their intake. If you cut down your intake with a suitable diet, is dieting. If you can't cut down your intake by a suitable diet, you need either a stomach operation, which is now going out of vogue.
Because it's been replaced by these drugs.
Bariatric surgery is now going out of vogue because you now have these drugs. And it's great that these drugs will now be available at a lesser price so that more people can access it. But you can't just keep taking drugs on your own. You must go to a doctor who is proficient with prescribing this drug so that you don't harm yourself.
I do want to ask you about the spine as well. We haven't spoken about the spine yet. We have a lot of instances of slip discs in India. What causes a slip disc and how can we prevent it?
So slip disc can be due to lifting a heavy weight suddenly. So if you're a weightlifter, slip disc can be because you have degeneration and then you've had a very strenuous bit of activity. The slipped disc comes out and it presses on the nerve. And the nerve is like having a switch at home. If you have a switch here which connects to that light there, if you press that switch, that light goes. The same way, slip disc presses on a nerve and the nerve then gets pain and it can get weakness and you get sensory problems, etc. But what is a disc? A disc is fluid-filled gel in between your vertebral bodies, which permits you to do movements. But if the fluid-filled gel ruptures through its content holding tissue,
Yes.
then you get a slip disc. And if you can get a slip disc from a sneeze.
Mm.
You get a slip disc from coughing. If you're asthmatic and you're coughing, you can get a slip disc. So slip disc can happen due to any of these kind of things. And when it happens, there's a whole line of treatment for it. medical and surgical, like in anything.
I have a last question. This one is from our producer Aaron, who wants to know: is there really a funny bone?
The funny bone is not at all funny. The funny bone, which has been described, is this area which you knock on a chair and you get pain, and it's not even the bone. It's a nerve. It's a nerve that gets hit, so you get tingling in your fingers. But the interesting thing about the funny bone is that it is touching a bone which is called humerus. And so there's nothing funny about it. If you break this bone, my God, it pains like anything.
All right, Doc. Thank you so much for your time.
Thank you for your time.